Hello, everybody. Good evening, good morning, good day, wherever you're joining us from. You're welcome to today's session with Met Transitions Ghana, which is the climax of our Met Transition Summit, dubbed Induction and Ethics Seminar Prep. My name is Dr. Vanessa, and I'm going to be your host for today's session. And I'm excited to let you know that today's session is going to be all sorts of amazing. We have amazing guests, as you can see on our screens, who are ready to share their experiences with us and make sure that we have all the right knowledge and all the right questions have been answered ahead of our big day. So, welcome once again. And a huge congratulations to you, doctors. I don't think I can ever get tired of congratulating you. It's been a very, very long journey and you very much deserve it. So, welcome, welcome, welcome. Just want to spend a couple of minutes sharing the link to any new doctor out there that you know of. Tell a friend that induction prep is up. Share on your WhatsApp status, on your Instagram. We want to get as many doctors here as possible and make sure that your needs have been met. Right. So before we continue, I have the utmost pleasure of introducing our guest, or more like have them introduce themselves when it's time. But two amazing people who will be with us. We have the first in no particular order, the amazing Dr. Emmanuella Addei, who was in your shoes about a year ago, feeling threat about how to go about induction and ethics seminar. But she's here today to spread some love and share her view and her voice with you. You want to say hi to our viewers and our listeners, Ella? Ella, can you just unmute and then say hi?
Okay, hi everyone. And once again, a big congratulations to our colleagues. Welcome to the noble profession.
Thank you, Ella. We also have a mighty man. Of course, we cannot have a room full of ladies without the voice of a man. So we've got an amazing doctor here as well to share his experience, answer your questions. So the guys, you are not left behind at all. In the person of Dr. Mohammed Ainooson. Dr. Mohammed, you're welcome. If you'd like to just say some nice words to our viewers and our listeners, that would be amazing.
Okay. Hi everyone. Welcome once again to this session. We hope after the session we get enlightened as to what to expect for the induction process. Thank you.
Awesome, awesome, awesome. Thank you guys for being here. And to our viewers, why don't you hear from you, where you are joining us from, what school you are also coming from. If you have any questions, feel free to drop it in the comment section at any point in time, and they would be answered. Right. So just to start off on a very light note, can you tell us a little bit about yourself, Ella? Maybe where you're working now and what rotations you have done, and maybe Mohammed can do that as you wait for a couple more people before we start. So, Ella, let's hear from you. Where are you now? What rotations are you doing?
All right, so I'm at 37 Military Hospital. I've done surgery rotation. I'm currently doing my pediatrics rotation, counting down the months to the end of first year and the beginning of my second year. It wasn't my first choice of a facility, but I think it's been very providential, and I've enjoyed my time at 37. Yeah.
Oh, that's so lovely. I love that word, providential. I feel like you're a woman of God already. Interesting.
Hey.
Thank you for sharing. Mohammed, what about you? Where are you? What have you done? How has it been?
Okay, so I'm at the Tamale Teaching Hospital, and then I've done my ops and gynae and currently doing internal medicine rotation. Well, I think it's been great so far, in as how the ops and gynae is structured and everything. I also didn't choose the facility, but then I think I've enjoyed my stay here so far.
Interesting. This is getting scary. A lot of I didn't choose my facility. I didn't choose my facility, but I love how you guys keep ending by saying that it's been an eventful and a powerful session. So, guys, if you don't even get to your facility, just know that you are in for a great treat. Okay, I think we have a good number to start our session today. Let's start with ethics seminar. What ethics seminar? What really is ethics seminar? How really is the experience? And Ella, can you just share with us what exactly the ethics seminar is about? How your experience is? to help our viewers and listeners?
All right. So you would notice that you received a lot of our doctors have received emails where they've seen their surnames with doctor attached for the first time in print. They find it very exciting, and it's very exciting. So in this email, you are told that you are being invited for an induction ceremony and an ethics seminar. So the ethics seminar is the first part. So actually, it's a 2-day program. The ethics seminar is what we do on day one, and then the induction ceremony is what's done on day two. So for the ethics seminar, it's a sort of like a typical day in medical school. You are going to have a series of lectures, but then these lectures are the kinds of lectures that you don't get in medical school. None of them really falls under any of the topics that we discuss in school, except maybe behavioral science in a sense for some parts of it. So then they are going to take you through some things in your profession that you would have to be mindful of outside of your medical school experience. And then they are going to give you a few tools that you would need for the induction the following day and then for your upcoming house job. So then with the program outline, you notice that you've been told that you should be there at 8 a.m. And for our experience, a lot of us ended up coming like 30 minutes, an hour before time. And the first lecture started around 8:45, 9 a.m. However, it's in your best interest for you to come early because before they start the seminar at 8:45 or 9, which is 45 minutes after the stipulated time, what they do is that you sort of you register your presence. So there's a sort of queue, should I say it's a queue? Like there are various stands that you have to go to. So it starts with a place where you go and take your name. And when you take your name, you would get to know your number. That is your seating number for the induction ceremony the next day. So first they take your name to show that you are present. Then they give you your MDC pin on a name tag. So they give a name tag that has your name, but also has your medical and dental council pin attached to it as well. Then they'll give you your lab coats. And I think for the first part, that's what you get, and then you take a seat. So it's in your best interest to come early because when you come early, you're able to get your name earlier. And for the first day, there's no hard and fast about where you sit. So you can now have the luxury of choosing where to sit. And also for those who are picky about the lab coats, some of the lab coats are going to be quite large, some are going to be small and medium. If you come early and you notice yours is a bit larger than you would like and you want to change it, if you come early, you might be able to go and get a smaller size. Because looking at the time you close from the ethics seminar, you might not have that much time to do any alterations for your big day, which is the following day. So you go there early, you get yourself registered, you get your lab coats, you get your MDC pin, then you get a pleasant place to sit for the seminar. So the topics they are going to talk about medicine as a vocation and remind you of the the weight of the profession that you have chosen to work in. They are going to talk about the ethics part of medicine. So they'll revise things that you already know, like equity, benevolence, beneficence, autonomy, all those things. Then they'll talk about the legal part of medicine. So they'll introduce you to what the Constitution says about the profession. In fact, it's very likely that you're going to have similar lecturers or similar teachers to those who taught us at our ethics seminar. So one of them is Dr. Ken Abwa. He would actually tell you that there's a part of the Constitution of Ghana that you're expected to know as a doctor because that's the part of the Constitution that is protecting you. But he will go into more details with that. And then my favorite part of the ethics seminar, they'll talk about practically about how to relate to your patients and how patients see the way we relate to them, how it affects how they receive the care we get from them. That part was so practical. It was so, for me, I found it very fun. The lecturer who taught it made it very interactive, very practical, very fun. So these things, a lot of them may seem like, oh, it's theory, we may not use it, but I think there are things that we should have at the back of our minds because you never know when you are going to need it. You never know when you are going to need your knowledge of the laws of the country in relating to a patient. You never know when your nice treatment of a patient or your smile of a patient is going to be reported to your superior. So even though it may look like those things are just skirmishes before the main event, I think we should be mindful of them. Just keep it at the back of your mind. If you are, so to speak, an oversabi student, like you are someone who likes to do things very rigorously and you want to write, there's nothing wrong with writing it so that in future you can refer back to it. Maybe next year, God willing, they might invite you to come and speak about the induction, and then you would need your notes from the previous year to remind yourself. So there's nothing wrong with taking a little notebook along to take note of the things you might forget. There are some things that they will say that will stick with you till now. There are some things that they said there, especially the lady who spoke about how to relate to our patients and how patients feel about the way doctors talk to them. Those things I think I still remember till today. So then you would go for a lunch break. They would give you lunch for the day. After all, you've paid quite an amount for the entire event. So it covers your lunch on the first day. Then you come for the second part of the seminar. That part talks more about the pressing matters. So they will talk about what to expect for the induction the next day. They will tell you to come early. They will tell you that the program would last till about 12:30 thereabout. And they are quite they stick to time. So you would actually close a bit early. Yes, so they'll tell you what to expect for the next day. They'll tell you how to log into the MDC portal. They'll take you through the steps. They'll show you some errors people um, commit when they are filling their logbooks. And then they'll tell you about the selection process for the hospitals. And they'll make you know that you wouldn't all get the hospitals of your choice. And they will outline all the excuses people give for which reason they want to be kept at a certain hospital and all that. And they will discourage you from trying to maintain a particular hospital or trying to change your hospital. These are things that they are going to say that I just want you to expect. Yes. So afterwards, right before you leave, they would share these invitation cards with you. So there has been a change in the venue. For us, we did ours at the Accra International Conference Center. So in terms of space and everything, it's bound to be different from UPSA. I've not been to UPSA, so I can't really predict how different, and I can't predict if it will affect the number of people that are invited in. But in previous inductions, it's only you can only have two members. Well, for our induction, you could only have two members of your family entering the hall with you. So they'll give you two invitation cards for the two members of your family you want to come. And the invitation cards are such that you can't even think of duplicating them because the nature of the sheets, the texture, everything is just it's unique. So once you get it, you hand it to the person you want to be able to enter. And so that's the last thing that they give you before you leave the induction hall. So after the lectures, they give you the invitation cards and then you are free to go. So for the ethics seminar, it's a bit fluid, it's a bit flexible. They don't really say you must wear a certain thing. You can dress like you would go for maybe your normal lectures on a regular Monday or something. And there's no hard and fast about where you should sit. So you just have to be attentive to detail and make sure that you don't miss any of the important things that you have to get, like your MDC tag and then perhaps your lab coat. And then as much as possible, just pay attention to the lectures. After all, you are there, so you might as well make the most of the time. So that's what you get to do for the first day. I think by 3 p.m. we were done with the ethics seminar. And so people were able to rush back into town to prepare for induction. And you see, it's in Accra. So for those of us who live in Kumasi, some may consider coming overnight. So some people came such that they ended up in Accra on the dawn of the induction, of the ethics seminar. But if you can also try and come the day before so that you'll be well rested and you wouldn't have a build-up of stress to the induction day, I think that would also be suitable. So that's what I can say about the ethics seminar for now. Thank you.
Thank you so much, Ella. That's quite comprehensive. I wish I knew this before I went. That's nice. That's interesting. And you guys closed at 3 or 4 last year?
Yeah, if I remember correctly,
That's
we closed in the afternoon, like late afternoon.
wow. Because I remember during my time we closed very late. think 5 or 6 p.m. Anyways, I believe it was because it was on a weekday, just like this year. Ours was on a Friday, so maybe that accounted for why we.
Hmm.
Anyways, Mohammed, do you have anything to add to the ethics seminar? Maybe how your experience was, anything that has not yet been shared? We'd love to hear from you.
Like, I think Emmanuella has done justice to the topic, so that's fine.
Awesome, awesome. Thank you. Take your flowers, Ella, for that amazing summary of what ethics seminar prep was. Okay, Mohammed, let's hear from you. How then was induction? I think everybody wants to hear about induction. What is the induction? What was your experience? Yeah.
So induction is where is the day that you'll be welcome. Let me say welcome or introduced or ushered into the profession. So it's actually going to be a big day as well as a happy day for most of you guys. And then so ideally it's supposed to start at up at the time that they advertise. It's at 9 a.m. So you have to try and be there before the 9 a.m. Like Ella said, before the induction day, they'll give you a lab coat and a name tag. So you try and iron, get all those things ready and nice before the day, so that you are not disappointed. Maybe light out or anything will disappoint you. So you iron for the guys. The dress code could be any nice professional outfit. A suit will be ideal. I don't think they'll be happy to see people in African wears and things. So a nice suit will be fine. I think Ella would throw more about light on the female side. So you dress well, come with your lab coat and name tag. So be in your best interest to set off early. You know that Accra traffic. I don't know. Those from outside Accra, you can get facilities around UPAC, even University of Ghana campus. I think there are some hostels around where you can lodge prior to the day. So that when the day comes, you set off early to avoid any traffic. Also, some people tend to do it this way. They try to get there before the 9 a.m., take pictures with some friends and families before the program. Because after the program, it will be difficult to get your friends because everyone will want to take pictures with their family. So it's kind of a bit difficult to get them. That notwithstanding, you can also, it depends on what you do. You can arrange with your friends and then you take your pictures after the program. During the induction ceremony, it's going to be a series of talk, and then the final part, a roll call where your names will be mentioned. So it will start around 9 a.m. Like Ella said, you'll be given 2 tickets to allow 2 people to enter into the auditorium. Last year, they went strictly according to the 2 invitation at the beginning of the induction. So those who came early, you bring your 2 people. But later, after around maybe 2 hours into the program, we could allow other family members to enter. I don't know whether they'll be very strict this year or not. Uh-huh. So, and it's when you get there at 9, you not like the day before. This time you are going to be seated according to your names. So there you'll be given a number, and then you'll be allotted a seat. So you have to go there early, find your seat, and know that this is where I'm going to sit. When you are done, after allocating your seat, you can go outside and take your pictures and do whatever you want till the start of the program. So the program will be a lot of speeches, advice, and also will be mixed with some musical interlude. So when it gets to the roll call part where Dr. Banyubala will do his thing. So you mention your name and then you mention about like a couple of names and then you clap for you guys. So he does that for everyone. After that's when you get to receive your. So when you are done, after the roll call, you sign for a provisional certificate as well as get your logbooks. So those on the induction day, you'll be expecting to receive your logbooks and then the provisional certificate. Yeah, so after this, I think it will take about 4 hours from 9 to around 12:30 to 1. So when you are done the induction, then those who are unable to take pictures with their relatives can also go and continue to the pictures with your relatives and friends, and then if there's any get together you want to, or a setting that you want to have, you can do that. I think this is what I can say about the induction ceremony.
Thank you so much, Mohammed, for sharing. Ella, can we hear from you? How was induction for you? And for the females as well, how can they approach that day?
Okay, so as my colleague Mohammed said, induction is a big deal. It's one of the few times in your career that you get to like celebrate your career actually. So you have induction, you have graduation, but graduation is not um as let me say celebrated as, because in graduation there is like a lot of other professions, you are all coming together, but induction focuses on you as a doctor. So the general advice is that make it a moment you can, as much as possible, as much as depends on you, you can remember with joy and not with stress. So as Mohammed said, you would have to try your best to come early, especially for the ladies. Things that you can manage to do before the ethics seminar day or on the ethics seminar day, so that the work you have to do on the actual day is less. Try as much as possible to do them. As you said about the pictures, including your, so to speak, professional pictures, the ones your photographers will take. If you can arrange with your photographer to have some of your photos taken before the program, I think as much as possible, please have it done that way, so that you come a bit early and then you take your photos before it's time for you to go in. I did that last year. What I realized is it took a lot of pressure of us. My colleagues and I were able to do that with the photographer. It took a lot of pressure off of us when the program ended. So we took our single shots early in the morning. The weather was cool. We were not we were not rushed. We were not sweating or tired or looking tired from like the whole day's events. So we were able to do everything calmly in our single pictures. Then after the program, our relatives who came later joined us to take. So after the program, we didn't have so many pictures we had to take because we had already taken some in the morning. Because when you close, everyone is all over the place. So first of all, there's a crowd. And then there are a number of people who might have registered with your photographer. So there's a bit of pressure on the photographer. There's a queue. You are sweating, you are tired. As much as possible, if you want to avoid stress, try to do everything so I can finish early. Then go early for the induction. Take your pictures ahead of time for those who pictures really matter to them. And then you would have to, depend on how many people you are expecting, the organizers tend to arrange for chairs and canopies. That was when we were at the Accra International Conference Center. I don't know if they are going to maintain that at UPSC, but if they are going to do that, they would speak to your various class representatives and let you know the price of the canopies and the price of the chairs. That's if they are going to do that. So if you are expecting quite a number of people, you can't guarantee that all of them are going to get into the hall. So they are going to have to wait for you outside. So you would be advised to book a canopy or book some chairs at least, so that your people would have places to sit. Some people end up having a mini party after the induction on the induction grounds. If you want to do that, if that's your way of celebrating that will make you feel happy, you are encouraged to do that. Some people too wouldn't expect a lot of family. They would want to go to a restaurant outside or have it more private. If you want to do that as well, it's up to you. Unfortunately, some of us were not Accra based at the time, so I didn't have any, I wasn't expecting a lot of family on the day, and I didn't have any restaurants or anything like that in mind. So it was later on in the evening when I and my dad found a place, and then we went to just enjoy the evening. But then you can speak to your friends who are crowd based, because they would have like experienced the various restaurants and would know which places have maybe the best tasting food and tell you the prices and all that. And then you can find a lot of the restaurants around the area on Instagram and on the internet, where they would give like ratings and everything, so that you'd have an idea of a place if you want a restaurant to go to. you can choose such a place. So that's what I can say for induction. That try to come early. Think about your family and friends who will be coming from outside. I think for now that's what I have to say. They're coming early and then setting up canopies and other things for your family that is coming. Thank you.
Thank you so much, Ella, for sharing on that. Very, very grateful. Guys, remember, come early. Everybody keeps saying it. Do try and come for the inductions early. We'll be taking questions, but before then, I just want to highlight a couple of people who have joined our group that are offering services to really help you if you've not made any decision towards your induction. I think they keep mentioning photography. So we have a Woods Photography who have joined to take pictures for those who are interested on the ground. So on that day, you can just contact him. All every information you need concerning how to reach out to him is also in your group, in our group, so you can just check out on that. We also have for the ladies and the guys who would like maybe some cake bouquet, some cake to celebrate your induction. We have roadies as well available to help you make all the last minute money bouquet, cake bouquet, and customized cakes you haven't yet done. The numbers are on the screen, and she's also on our page. So you can just reach out to her and make all your bookings ahead of the day. And finally, I haven't heard anything about an official communique about tents, but one of us has reached out to me that they are trying to get a place where you can relax and sit and have a meal with your family for those interested. He's Derek from KNUST as well. And those who are interested can also contact him. His number is on the screen. He's also on the page and he has posted his information. So you can just reach out to him and get them done. Right. So, in the absence of any extra information, let's just move on to our questions and we'll be able to wrap up and have a beautiful rest of Saturday. If you have any questions, please do feel free to put in the comment section and then we'll answer them. Right. So our very first question is from Kwamena. Kwamena is saying that can you expand on what you mean by presentable? Because some schools don't consider an African print shirt as official. I believe this is for the ethics seminar, right? So can anybody take and handle this for us? What do we mean by presentable for ethics seminar?
All right. So for the ethics seminar, take it as you are going for a lecture with some members of the medical and dental council. So if you are going to wear an African print shirt, I mean, you can wear it. It depends on how you would wear it. Normally, the longer sleeved ones seem a bit more formal. But we are not saying for the ethics seminar, you don't have to do anything too over the top. You just have to look like you would have looked on a Monday at lectures. So you don't have to wear a tie for ethics seminar. You can just wear your neatly ironed shirts, trousers, and then your shoe. But don't send maybe slides. I mean, don't send Crocs or anything that looks so noticeable. So like something that people see and they can really notice it. As much as possible, you want to be noticed for the right things. Because some of the people who are coming, um, Mohammed mentioned Dr. Banu Bala. Yes. So some of the people who are coming are, are your bosses in high places. So you just want to fit in the mood. So if it's in a good sense, so you can just wear your neatly ironed shirts and trousers for the gentlemen. For the ladies, you can wear a simple straight dress or a top and formal trousers. Just don't look too um too comfy. And then for I actually forgot to mention for the induction itself, for the ladies, a lot of people I think it's more of a personal, in a lot of ways it's personal. It's what you feel comfortable and confident in. because the truth is that a lot of people are going to. Exactly. So if it's for the ethics seminar, you can wear an African print. You can, it's not, you don't have to look so over the top. But then for the induction, people are really going to put their best foot forward. Not to say compare yourself to people, but if you underestimate it, you might come and then you'll be shocked. You'll be shocked that the kind of um efforts people put into it, such that your underestimation will become very obvious. I don't know if what I'm saying is sounding like, if you underdress, you will know that you've underdressed. Like if you didn't put a lot of effort into it at all, like maybe you wore sandals and you wore your everyday African prints, it's going to be very obvious. I've seen people wear kaftans for the induction, depending on how well they were able to rock it. It actually became a point of controversy for some. Some people said, "Oh, the kaftan was fine. That's what they were comfortable in. They look nice." But other people were like, "Oh, for induction, kaftan, they could have done, so to speak, better." I think it's more of what you are comfortable and confident in. No one is going to chastise you for wearing your kaftan for induction. But if you're going to wear maybe some short-sleeved African shirts, African print shirts, and your everyday black trousers with sandals, you are going to look very noticeable in terms of, like he was very extremely simplified. If that is what you are confident and comfortable in, then well, you can still do that. But for me, the key things are confidence, comfort, and remember that it's a celebration. Once a while, you have to do something nice for yourself. For the ladies, what is really in vogue nowadays is this kente. A lot of people are going to wear kente. I don't know if it's going to change this year, but for last year, kente was the rage. So some people look like they were going for, it's like engagement level kind of kente, and that's what they wanted, and that was fine. Some people too wore suits, well tailored suits. They weren't as many. Some people wore there's this kind of print that they sew. Can't remember the name now, but I saw a few people in that print as well. And it wasn't a competition. It was what people were comfortable and confident in. That also looked very nice. Some post kente looked like they could have worn it for their wedding. Some post kente also looked like it was made for like a formal event, but not up to wedding level. But everybody looked nice, and that was the most important thing. And for the ladies too, a lot of people do makeup, like 97% or 99. A lot, it's going to be like the order of the day. There are a few people who wouldn't want to do it, will not do it, and it's not going to be a crime. They will still be okay. They will still be fine. They will take their pictures. It will all be nice. But then, if you are going to do makeup, make sure it's not your makeup that makes you late, and consider the fact that you are going to be in that makeup from morning till most likely till night. So do something that is not going to sweat is not going to be a problem with. Do something that it's not so heavy on you that's like you are so conscious of it. So as much as you want to look your best, also consider the fact that whatever you are going to be wearing it for a long time, probably for the whole day. So that's what I can say about attire and makeup. If you want to go with what a lot of people are going to be doing, then know that for the gentlemen, a lot of them are going to be wearing suits of different colors. And know that for the ladies, a lot of them are going to be wearing kente, and a few will wear suits. But if you want to stand out and you can do it in a way that works out beautifully, you can also go for it. Yeah, that's what I can say. Thank you.
Thank you very much, Ella. Mohammed, do you want to add anything to it?
Yeah, so I think for the induction, they should try, if they can overdress, they should dress to kill that day. But that day is it's once in your lifetime. So the guys especially, if you have suits, get your nice three-piece suit or any nice suit. The ladies, yeah, that's what Ella said. Someone just asked me if they can do blonde wig. I don't know whether Ella or Vanessa can say anything about it for the ladies.
Okay, thank you. So, from what before I let Ella comment, Remember the three C's: comfortable, confident, and celebrate. And Dr. Mohammed says that induction is a once in a lifetime. So make sure that you dress to kill. Ella, do you have any comments about the blonde wig? Did you see any during your session? What do you have to say about it?
During our session, I didn't see any blonde wigs. I think there were colored wigs, but then nothing too overly bright. You know, you can wear a blonde wig, and depending on your tone, like your skin tone, and also what you are wearing in addition to the blonde wig, it wouldn't look too loud. A lot of the ladies wore like wigs, but it wasn't. A lot of them weren't very loud in terms of the color. Some people wear blonde wigs, and depending on the color of their skin and also what they are wearing, it goes well with this. I'm sure no one would chastise you for wearing a blonde wig. I remember distinctly that there was someone who had like a lot of hair, like she had blown out her hair and it was so massive, like it was so noticeable, but no one said anything about it. And it was black. So was it black? It was black, either black or it was a light brown. Like it was so noticeable, but people didn't really talk about it. So a blonde wig, it depends on what you are combining it with. I don't think anyone would see it as a crime. Yes, I think it would work. But remember also that there are lots of biases that people have when it comes to the medical profession. Right from medical school, they give us a lot of rules about the color of your braids and your no tattoos and no earrings and all those things. I think in a lot of us, in our minds, subconsciously, that rule undertones even the induction. Because once again, remember that in as much as you are doing all these things, you're going to take your logbooks and you're going to take your certificates from the MDC squad who will be sitting there. You wouldn't want anyone to make any comments that will affect the tone of your day. So if you are doing any of these things, yes, dress to kill, but don't dress to kill your joy on the day as well. Make sure that whatever you're doing is like within the acceptable standards of our general society. That's what I can see. So the blonde wig, it depends. It depends on what you are mixing it with and how it goes with the rest of what you're wearing.
As she all had the blonde wig, it depends. I don't think anybody had such loud hair. But once again, it's in as much as it's a big day, it is still a formal sort of day. So try and be circumspect in how you go about your dealings. Okay. It may have an issue, you may not have an issue, but I'll say always toe the safe line when it comes to these kind of things. All right, we have another question that is asking, please, is there a penalty for not attending the induction or ethics seminar? I think I want to hear from Mohammed first, and then maybe Ella can top up. Is there a penalty if I don't attend the ethics and induction seminar? Hello, Mohammed. If you are speaking, we can hear you.
Hello, can you hear me now?
It's a bit, there are some technical hitches.
Hello?
Hello?
Yeah, can you hear me now?
Yeah, we can.
Hello?
So it looks like Mohammed's line is not so great. Ella, can you take Mohammed tries to fix this line?
Okay. So there's I think should I say it's a penalty. Once you are going to be working as a doctor in Ghana, you would have to it's like it's should I say it's a rite of passage. You'd have to have the induction. Even the ethics seminar, they sort of mark your presence there. And that's why you're going to get the tickets and the lab coat and the pin. So it's like you have to be there. For our colleagues, I know there was one person who was unable to attend because the person was out of the country. So they slated her in with the next induction. You see, it's not everyone, not all the medical schools in Ghana have induction on the same day. So after she missed our induction, she was slated in for the next induction. So the penalty would be that you would have a delay in when you start your house job. You would still have to be inducted. So they would add you to the next batch of inductees. That's as much as I know. I don't know if there's any extra penalty, but that's what I know.
Mohammed, are you back? Do you want to add on?
Hello, can you hear me now?
Yes, yes, we can hear you now.
Oh, okay. So I think it's the same with what Ella said. You just have to join the next batch of inductees. Uh,
Absolutely. So you can't afford to mix induction in your batch, even the ethics seminar, because I think even before I went in, someone told me that it's a compulsory rite of passage. Okay, so you definitely would have to induct before you start house job or start as a doctor. If you, for some reason, you will not be able to join them, please do send an email to MDC. I believe their emails are on their website, and let them know that you will not be able to come so that they can have a communication with you and decide on how best you can go about induction and ethics seminar. Okay, we have our next question. Person is asking, can you please tell us what the logbook is? Interesting. Means this person wasn't around for our summit, okay? Ella, no, Mohammed, can you tell us what the logbook is?
okay, so the logbook, as in, so when you were in medical school, you used to sign logbooks with respect to all the rotations you were going. So the same thing with house jobs too. You, depending on the rotations that you'll be doing, generally the four main ones are the obs and gynae, internal medicine, surgery, and then pediatrics. But some people will like to do replace any of these with either emergency medicine or anesthesia. So I don't know about the dental people, but for the medical people, these are the four main ones. So depend where you are required to fill these logbooks as and when you are doing a house job. So when each rotation is like 6 months. So by the end of the 6 months, you should have filled what you did during the house job. So every month you have the activities you are supposed to do every month. So their logbooks will let you know the things you are required to do every month for you to. That the things expected from you by NBC. So when you are done with the 2 years, you have to submit these logbooks to NBC. They'll go through before they'll issue your. If they think you've met the requirements, they'll go through and then they'll allow you to proceed to do your permanent registration. So it's an evidence to show that you've done something, you did the house job, something like that. That's what I can say for now.
Okay, thank you so much, Mohammed. Ella, do you want to add something to what the logbook is?
Oh no, I think he's explained it perfectly.
Awesome, awesome. Thank you. I don't think anybody has spoken about food, guys. You kept saying that we stay there from 9 to maybe 3 or 4, or we stay there from 9 to 2, maybe for the induction. Will they serve us food, or they'll give us a break and I have to go and look for my own food, or how is the food system like for you guys? Maybe Ella can start and then Mohammed will add on.
So for the ethics seminar, they gave us lunch. That one I remember. They gave us lunch. So we had a break and then we had some nice orderly queue. They had already arranged the food for us. And so for the ethics seminar there will be food. But for induction, there was no food. So you have to sort out the food arrangements for induction.
That's interesting. Mohammed, was the same for you? Was it the same for you?
Yeah, exactly. It was the same. So if you can take something before the program, that's fine. But if you think that would delay you, you just have to wait fast small after the program. Then you go and have your mini party, go and sit somewhere with the family, and then enjoy. But
That's
then the program, the second day, they won't give you any food. That's
wow. That's very interesting because when you pay for the induction and ethics seminar, lunch is part of it. And I do remember they gave us food on the lunch and lunch actually on ethics, but they still gave us some savories on induction day. So I'm wondering how come you guys didn't get savories. Anyways,
okay.
guys.
You guys were lucky.
Oh, wow, that's a new
Yeah, I
discovery.
remember some small chops, some meat pie, and some drink. Interesting.
Mm,
Well, there you have it. So looks like you will only be fed on ethics. Maybe you'll be lucky this year because it's in UPSA. You may get something after the induction. Right. Are there any questions? If you do have any questions, do feel free to put them in the chat box and we'll have them answer before we wrap up today's session on ethics seminar. Do you have any advice for our viewers as we wait for any of the questions coming? Ella, do you have any advice for them as they're about to enter into this noble profession called medicine and dentistry?
Well, um, what can I say? What I can say is it's going to be a ride of many emotions and situations. So think about how you started medical school. When you started medical school, a lot of people started with a lot of fire and excitement and joy. And I think the transition from medical school to house job is like that. You take your pictures, you release your pictures, you'll be so excited. You will go for induction and graduation. You'll be excited. You would like it's going to be like one of the highlights of your life, so to speak. And some people would be looking at you from the sidelines and just be they'll be having mixed feelings. They'll be happy, but at the same time they will be concerned because they know some of the stresses that's coming being a house officer. So think about it like the same way you entered medical school with joy and then you went through some ups and downs and you are ending with joy. As you are finishing medical school and transitioning to starting work, it's just like that. You will start with joy, you will start with excitement. And so make sure that live in the moment. Don't be thinking of induction at the same time you're worrying about the horror stories or the discouraging stories you may be hearing about house job. Like whilst you are in the time of celebration, enjoy that time of celebration so that in the months to come you can look back on it to encourage yourself. You can look back on it to remember that you are living in what you prayed for. Yes, I think that's what I want to say. That's as much as possible, enjoy the moment and use it as a reminder to yourself when things become a little challenging that this is what you prayed for and it's still worth it. The house job, I know they've taken you through, Med Summit has taken you through how it's going to be, so you already know what to expect. So that's what I would say.
Thank you so much, Ella. Mohammed, please can we hear from you? Any last words, final words, words of encouragement, final words to our dear incoming doctors?
Okay, so I think yes, like Ella said, you have to enjoy your ethics and induction because it should be a happy day of happiness. You don't have to go there and be sad. Doing the house job, so at the beginning of the house job, when you're finding your feet and not finding your feet, it becomes a bit uh, some way. But then enjoy the moment before the house job. I don't think anyone wouldn't want to be inducted. During the induction, Dr. Baniwa will pass a comment that before he does the roll call, if you are there and you want to go out, you don't want to be inducted, you can come for him to cancel your name before he does the induction. I don't think any one of you would want to be doing that after 6 or 7 years of medical school. So you worked hard for this. Enjoy the induction, and we'll be happy to see you when you come to the various facilities to do the house job. Thank you.
Thank you. And I guess we don't have more questions. So I would humbly thank my amazing guests who have been here. Thank you, Dr. Addei. Thank you, Dr. Ainooson, for gracing us with your experience, with your wisdom, with your encouragement, and helping us prepare for our incoming August occasion. Thank you too to our viewers and listeners who are here. If you still have any more questions, feel free to put them in our Med Transitions JHO Summit WhatsApp page and we would gladly answer them for you. Thank you for joining us this evening. My name is Dr. Vanessa and I have been your host for today's session. On behalf of Med Transitions Global, we say Thank you and enjoy the rest of your evening. Okay. Bye bye. Have a good evening, everybody.